You're watching WKBN 27 First News, where your news comes first. Now, in high definition.
Welcome back. It's time for our Live at 5. We are joined by special guest Dr. Michael Sevilla from Salem Community Hospital. Today we're talking about strokes, and it's very timely because May is actually American Stroke Month. So first of all, when we talk about a stroke, it can have serious impact on our health. So tell us a little bit about the impact of having a stroke.
Well, stroke is the third most common cause of death in the United States, and every year almost 800,000 Americans have a stroke, and that comes up to about a stroke every 40 seconds, and it is the leading cause of disability in the United States as well.
Every 40 seconds, that's pretty impressive. So obviously we're trying to lower that. So what are some of the warning signs that we know that we might be, having one?
The most important thing about a stroke is that these symptoms come on very sudden.
Okay.
And it can be anything from weakness on one side of the body to difficulty with talking, to confusion, to difficulty walking and talking. It doesn't have to be, very sudden. Well, it does have to be sudden, but it doesn't have to be very severe.
Okay.
It can be very, very subtle, and that could be the only sign of a stroke. And if you see any of that symptoms at all, call the ambulance, get to the hospital right away.
Okay, and how do we prevent it? Obviously, that's something that we want to make sure that we know how to do, and we can. These are things we can do.
Yeah, part of the most important thing is to control your blood pressure. 120 over 80 is the key number.
Okay.
When it comes to cholesterol, definitely control your cholesterol, especially if you're in a higher risk group. If you have diabetes, if you've had heart disease, heart attack, a stroke in the past.
Okay.
If you're a smoker, definitely stop smoking. It also helps for heart disease and heart attacks as well. But probably the most important thing is to recognize the symptoms early so you can get to the hospital and get treated.
So don't discount those things. If you're starting to feel those things, don't just brush it off and think that you're going to be okay.
That's right.
All right, doctor, thanks very much. We appreciate your advice as always. And you can always get more on our website at WKBN.com. All right, stay with us. We'll be right back.